Welcome to a special edition of DocTalk with the MedHealth Clinical. I have the pleasure of being here today with the Director of Medicine and Primary Care Physician of MedHealth Clinical, Dr. Fabian Garcia. Thanks for coming to do this with us today.
I can't tell you how excited I am to do this, Antoine. Thanks for having me.
Yeah, man, it's a pleasure to have you here. So let's talk a little bit about who you are, what you do, and a little bit about your background. Tell us a little bit about yourself, Doc.
Okay, I like to start out telling folks, just because it gives them a little bit of insight as to who I am. Played football in college on a full football scholarship. I say that to say just into my body, into sports in general. I like to say if I wasn't a doctor, I'd still be into health, either way.
Yeah.
Competed in bodybuilding contests, just very, physical minded. Went to medical school kind of later in life, so was already like a full grown adult, 30 years old, went to medical school, came back to Orlando, did my residency right here up the road at Orlando Regional Medical Center, downtown Orlando. And, now we've just, we found a niche of people that we're trying to serve, helping them get off medication, and we've started the MedHealth Clinic, and, very proud of it, obviously.
Right. Interesting concept that you have. You have a slogan that's called More Health, Less Medicine. I thought that was pretty interesting. Tell us a little bit about it and how you came up with that.
Well, your viewers are going to know you don't have to be a Harvard graduate, right? If you're taking medicine, you're probably sick. There's probably something wrong with you, right? And so intuitively, I think there's a group of people that want a physician to show them how to come off the medication. And it just seems like that's a void in the medical community. Everyone's giving you more. Here, take another pill. Where when I speak to my patients, they're pretty clear. We don't want to use this stuff. And I just, I want patients and I want Orlando, Winter Garden, and the surrounding area to know there's a way back. You don't have to stay on these meds. There's a way to improve. Don't let your doctor tell you that you're married to these pills, because you're not.
All right. Very interesting concept. Tell me a little bit about what the major concern is with most of our individuals who are walking around that you see as patients as it relates to weight.
Yeah, as it relates to weight. So what I do when I have a patient, the first thing I ask them is, what are your goals? And so they may have a goal of, less thyroid medicine. They may have a goal of, their back hurts. But universally, their goal is to drop a couple of pounds. They intuitively understand that their clinical picture is being dominated by obesity, right? And like 65% of Americans are obese. So everyone is looking to lose weight. Now we're in this era of the GLPs, the Ozempics, the phentermines, right? And everyone's giving you the pill or the answer. And so I think what they're looking for is kind of a cogent plan, because again, they'd rather do it without medicine, but is it possible? And yes, it's possible. And that's what we do all day.
Well, obviously you have a plan that you're going to share with us today, right?
Bottom line is, no doctor's going to fix you. No doctor's going to fix you. You have to fix yourself. And so what the plan is basically just to educate people and show them, like, what are the easier moves that you can make that are going to give you the bigger bang for your buck? What's a livable plan? Give you a strategy. And if the patient wants it, that you can have it.
Great. Glad to hear. Well, if you're tuning in today, Doc is going to share that very plan with us today. So we're looking forward to hearing more. Let's get into it.
All right, so we want to get better. You want to get better, I want to get you better, and you're going to get better, right? But let's not fool ourselves. This is going to take a little bit of effort, a little bit. I equate it to the amount of effort it's going to take you to stay mentally tuned in while I explain these slides, which is going to take about 30 minutes, right? So if you can stay in for 30 minutes and maintain your attention, that you have what it takes to be able to reap whatever benefit you're trying to reap. So if you've got high blood pressure, you can reverse it. If you've got diabetes, you can reverse it, right? If you've got rheumatoid arthritis, ulcerative colitis, Crohn's disease, all these things can be reversed. Just pay attention, you're gonna get it, okay? So I never speak to an audience without putting this slide first. This slide helps us keep our head in the game. What are we doing, right? So the first duties of the physician is to educate the masses to not take medicine, which seems kind of weird because every time you go to the doctor, you always end up leaving with like a little bag of scripts, right? So who said this? So we can determine if this was a homeless guy that lives under a bridge, we can blow him off, right? Turns out he's not a homeless guy that lives under a bridge. This is Dr. William Osler, right? So I lovingly refer to William Osler as like the Wayne Gretzky of doctors, right? I don't know anything about hockey, right? But if you show me Wayne Gretzky, I'll be able to say, okay, that's Wayne Gretzky, right? So this is who that is of doctors. He, if you look him up and you read about him, he's widely regarded as the father of modern medicine. So here we have the father of modern medicine saying, docs, try to keep your patients from taking meds, right? He also started the medical school at Johns Hopkins University, obviously a very prestigious college. And then he also was the one that came out with the idea that all of the doctors that any of you ever seen had to go through residency. They had to go through residency because he felt like it was necessary that medical students spent a little bit more time in this cocoon to be able to learn a little bit better, right? But Dr. Osler died in 1919. That's before the obesity epidemic that we face, and that's before the diabetes epidemic that we face today, right? So if he were here, I'm quite sure he wasn't trying to say, hey, docs, haphazardly remove your patients from their medications. No, he was saying, docs, it's your job to teach people how to live so they don't need so many pills. And that has always just intuitively, before I went to medical school, when I was just playing football, it seemed like there should be a way to get better, right? And so that's kind of what we're here to do. This is my medical license, the poetry behind it being that I kind of staked my entire career off of this thought, okay? Good, so let's get into this. Now, I am an internal medicine doctor, okay? And so for those that don't know, I see adults. So I got patients that are 18, and in my practice, I have a couple of patients that are in, triple digits. I got a 102-year-old lady. And I can tell you that after having done this for 10 years, there's no doubt that we are all going through this same human experience, right? We're all taking laps around the same track. 20-year-olds have 20-year-old problems, 40-year-olds have 40-year-old problems, 60-year-olds have 60-year-old problems, et cetera, right? For example, I like to use the example of the 20-year-old man, right? If a 20-year-old man comes into a doctor's office, I can tell you with 99% certainty he's going to talk to me about his penis. There's something wrong with his penis if he comes in his 20s. And 20-year-olds are very jumpy. So they're going to say something like, hey, doc, I got something on my penis, man. You got anything for that? Yes, I do. It's a very common problem. You need to wear a condom, by the way. And take this, you're going to be fine. Common problem in the 20s, right? Decades pass by. 30s, 40s. Now a 50-year-old man's going to come into the office, and he's much more subdued and controlled, and he's going to say, doctor, my penis doesn't work the way it used to before. It doesn't kind of function as well. Do you got anything for that? I say, yes, I do, sir. It's a very common problem for the 5th decade. Take this, you'll be okay, right? Decades pass, 6th decade, 7th decade comes in, and now the patient comes in and says, doc, my penis is leaking. I'm dribbling all over the place, right? You got anything for that? And I say, you know what, sir, that's a very common problem. Yes, we do. Here, take this, you'll get better, right? And then decades pass, 8th decade, and then the 90-year-old man comes in and he says, what is this thing? Do I need this? Where's my wife? I want to go home, right? It's my little joke, but the point is, this is the life cycle, and it's just playing itself out over and over and over, and nothing is new, right? So when I started this job as an internist, I immediately started to notice a trend, right? So the trend is, I felt like I was seeing certain amounts of certain age demographics, right? And so I peeled 10 days of my schedule, and I wanted to count how many of each age demographic am I seeing. So you can see in this chart, this is the demographic. So these are 20-year-olds, 30, 40, 50, 60, 70, et cetera, right? And this is how many of them I see. And what I noticed was I was only seeing a handful of 20-year-olds, handful of 30-year-olds, a smattering more of 40-year-olds. But then all of a sudden, boom, look at this, right? We go from seeing maybe 10 40-year-olds to all of a sudden 45 40-year-olds, 50-year-olds. So what's happening? What's happening at this stage of life? Something is clearly going on that's causing this big jump. And you may be saying to yourself, but Dr. Garcia, look how many 70-year-olds you see. But I would tell you that 70-year-olds have something called Medicare Advantage, meaning they can come and see me and they don't have to pay any money at all, right? So they come in to tell me about their avocado trees. They come in to tell me about their riverboat cruise, right? They come in to tell me about what they got growing in their backyard. But these people, the 50-year-olds, they had to take a day off of work, right? They had to take a day off of work and they had to come pay me. So let's take a look. I'm an expert at this particular demographic, so I'm going to go ahead and present to you a fictitious patient.
Did you know that a well-crafted promotional video can boost your company's brand recall more than any other type of communication to potential customers? How much more? Up to 80% more. Your audience tends to allocate more time to a video than giving you an opportunity for an elevator pitch, email, or text message. Your business can have its very own explainer video or commercial for as little as $500. This enables you to advertise on all media platforms. Call 321-229-1307 to get started today. Advertise Orlando, we make businesses famous.
Soy el doctor Fabian Garcia, médico primaria y especialista en medicina interna aquí en el MedHealth Clinical. Quizás te has preguntado, ¿habrá una manera de tratar mis condiciones crónicas, tales como presión alta, colesterol y diabetes, sin tanto medicamentos? La respuesta es sí. Cada día trabajamos para responsablemente eliminar el uso de tantos medicamentos y ayudarles a tener una vida saludable. Haz tu cita con nosotros y vamos a tratar tu caso.
So I'm going to present to you a fictitious 50-year-old patient. Okay, we're going to call him Tito, right? So Tito, he's 53 years old. And for those of you that don't know, the fifth decade, that's heart attack season, okay? So when the 50-year-old comes in, he's going to come in with a 50-year-old problem. And 50-year-old problems are usually lower urinary tract symptoms. That's, again, the erection stuff. Or they can't pee right. Or they're having musculoskeletal pain. Or they're having problems with sleep or depression. These are 50-year-old problems, right? So if you've ever seen me in clinic, it's always the same. I take your chief complaint. I decide if you need any specific labs to be drawn or if you need to have any imaging drawn. And then I send you away and I see you back in a month for a physical exam. Now, when I see this 53-year-old male in 1 month, I can tell you with 85% certainty this is what we're going to see, okay? We're going to run into him. He's going to come back in. He's going to have a blood pressure of about 146 over 87. It's a little high. Right? We're going to go over his blood work, and I'm going to see that he has elevated triglycerides and LDL cholesterol. So his triglycerides will be, let's say, 190, and his, let's say, TG, and his LDL will be 140, okay? He's also going to have abnormal fasting glucose. We'll give him an A1C of 6.0, okay? Now, my job, you know, if you want to church my job up, you should say, well, I'm an internal medicine specialist. I should know the top 5 pathologies across all the organ systems. So I should know about neurology. I should know about pulmonology. I should know about nephrology and dermatology and cardiology, right? But bottom line, my job is to reduce the risk of heart attack and stroke in my patient population, okay? So I want you to understand my problem. This is the problem that I have with the current medical paradigm, okay? So I've been given the pharmacopoeia, which is basically refers to all the medications that exist. And I'm supposed to use the pharmacopoeia to reduce your risk of heart attack and stroke. So follow along with me, all right? So we got a patient that has a little bit of hypertension, okay? That's a risk factor for heart attack and stroke, and we have to fix it, okay? So everybody in the audience here, my little studio audience, we're going to start with a beta blocker, okay? So a beta blocker, that's metoprolol, carvedilol, misoprolol. There's a whole class of medications, right? So I want all the gentlemen, please, hands up, please, for me. Humor me. All right. So which of you gentlemen would like to have erectile dysfunction? Please leave your hand up high. You want to keep it. There it is. There it goes. There it goes. The hands always come down when I ask for that. Number one side effect of beta blockers and number one reason for non-compliance with beta blockers is erectile dysfunction, right? So, all right. So let's not use that. We don't want that, right? So let's move to the next class of medications. Anyone ever heard of calcium channel blockers, amlodipine, nifedipine, verapamil? Okay, no one in here has, but the people at home will know what I'm talking about. These are calcium channel blockers. Famous side effect is constipation. Famous side effect is lower extremity edema, swelling, right? So we'll do calcium channel blockers. We don't really want to do it. Let's not select that one. So we're going to go to the next class of medication, which is called angiotensin converting enzyme inhibitors. We're talking about lisinopril, enalapril, captopril. Anyone ever heard of these medications? Okay, everyone at home will be familiar with them too. Now, common side effect, cough, and the only patient that I have ever intubated in my entire career, right? So I'm walking out of the ICU and I hear someone pop their head out the door, "Doctor, quick, we're losing his airway." That's the last thing you want to hear when you're trying to walk out the front door of the hospital, right? Is we're losing an airway. So I walk into the room, the patient's in there, his tongue sticking out of his mouth, and he's drooling down the side of his mouth, indicative of having lost his airway. His throat is swelling closed. We have to intubate him, get him intubated. Now you can kind of breathe and hang out for a second. Now, your job as a physician is to figure out why this happened. We go to his medication list. He was on lisinopril. The treatment for this patient that was about to die is stop lisinopril. That's what you do, right? So what I'm trying to get at is all that quick talking at the end of the commercial, drug may cause death, or side effects include, tuberculosis, all that stuff that they say in the commercials actually happens, right? And I know that, and I don't want to risk it on you all. So ACE inhibitors, we're out of there. But you get what I'm trying to say. This is just one problem, right? That's just one. So let's go to the next problem just for completeness. Triglycerides, LDL, elevated. Also a risk factor for heart attack and stroke, right? So have you guys ever heard of statins? Atorvastatin, rosuvastatin, right? They give those out to Americans like they're M&Ms. But if you go on your phone and you look at common side effects of statin medications, it's cognitive impairment, rhabdomyolysis, which is when muscle tissue breaks down and clogs up the kidney. You can have arthralgias, which is joint pains, myalgias, which are muscle pains. So statins, I don't really want to do those either, right? And then just for completeness, like I said, A1C of 6.0, now that's abnormal fasting glucose, prediabetes. Anyone ever heard of metformin, right? Anyone like diarrhea? That's what you're going to get from it. Anyone like abdominal pain? That's what you're going to get from it. So let's move away from metformin and let's do glipizide. Everyone's heard of that. Abdominal pain, life-threatening hypoglycemia, meaning your sugar can drop too low with this medication. The point I'm trying to make is, guys, I'm navigating this minefield of side effects on my patient's behalf, and I don't like doing it, right? Especially when I realized very early on in my career that the common denominator behind all of these problems, so hypertension, elevated cholesterol, elevated A1C, is a BMI, body mass index, greater than 30. Now, what we're talking about is the metabolic syndrome. Okay, so you have hypertension, elevated triglycerides, abnormal fasting glucose, and obesity. This is Syndrome X, also known as the metabolic syndrome, and its roots lie in insulin, too much insulin. So just stick with me here for a minute. I realize that the etiology, meaning the grano, the crux of high blood pressure, high cholesterol, diabetes, and obesity is too much insulin, right? So what's the obvious conclusion? The obvious conclusion is teach these people, the 40-year-olds, how to fix hyperinsulinemia, that's what it's called, hyperinsulinemia, before they turn 50 and this increase happens, right? So this used to be called my Checkpoint 40 talk. Okay, and my whole thing was, listen, I had it all mapped out. I was going to be famous. I was going to be on the I-4. There was going to be billboards. There was going to be billboards on the 408. There was going to be bus stops and everything, and it was going to be, checkpoint clinic, and I'm going to teach you how to do it. But when I started trying to implement this with 40-year-olds, I quickly and immediately learned 40-year-olds do not listen. 40-year-olds are like the teenagers of the life cycle, right? They think they got a career, they got a car, they got a couple of kids, and they haven't been kicked in the nuts yet by a disease, so they aren't really into changing their habits. So I just started passing this information to everyone. And what I began to see, and this is around 2018, is I began to see, my MA would say, Dr. Garcia, patient lost 30 pounds. And then when a patient would lose 30 pounds, you have to remove their blood pressure medication because their blood pressure is getting low. And once they lose 30 pounds, you have to take off their diabetes medications because their sugar was growing low, right? So I have seen just spectacular results, thousands and thousands of patients, and I feel very confident saying that no matter what your clinical picture is, what we're about to discuss is going to improve it. All right, so I say this every single day. Patients who know better do better. So you just have to understand how insulin works. And once you understand how insulin works in your body, you are in control. You can get rid of your diabetes, you can get rid of your hypertension, you can get rid of your cholesterol issues, and you can lose weight, okay? This is what you need to know. This circle represents 24 hours in a day. Now you can adjust this however you need to adjust this. I'll do this on my eating schedule, okay? So what I need all of you at home to know is, okay, and we'll use my dinner time. My dinner time is at 8 o'clock. Now, all you need to understand is the hormonal implications of the food that you're eating, okay? So it doesn't matter if, you Puerto Ricans, if you're having tostones, or if you're having mashed potatoes, or if you're having chicken. Your body doesn't even know what any of that is, okay? Your body just breaks it down into usable nutrients, right? And when our bodies see usable nutrients, we are machines of storing nutrients. The way your body gets them is with a hormone called insulin. Okay, so you eat, you digest the nutrients, your body kicks out insulin, giving you the signal to store. Eat again, see more nutrients, more insulin, store. Okay, and that pattern repeats itself day in and day out. Okay, now insulin is on a seesaw with another hormone called growth hormone. Okay, and growth hormone has the exact opposite effect of insulin. So if insulin is saying to gain, growth hormone is saying utilize. Okay, so now this is just a pattern of eating that reduces insulin. And when you reduce insulin, the natural consequence of that is increased growth hormone. And when growth hormone comes out, your body has no choice but to catabolize, break down, to use. Okay, so watch. My wife knows dinner's at 8 o'clock. Now, after 8 o'clock, you need to be trying to intentionally avoid insulin. There's only 3 things that you can put in your mouth that don't stimulate insulin. Ice cream is not on the list, okay? They're not very fun. You can put water in your mouth. Water doesn't stimulate insulin. You can use, if you choose at this hour of the night, black coffee. No cream, no sugar. Because even the cream and the sugar in the coffee is going to stimulate the insulin that we're intentionally trying to avoid. Or, if you would like, you can do green tea. No cream, no sugar. Okay, now, my next question for my patients is, what time do you lay down for sleep? So we're using my example. I lay down at about 10:30. Okay, now, okay, so we're back. Now, if you're like every red-blooded American, after dinner and before bed, we're all doing the same thing, right? We're all having maybe some juice or maybe some crackers or maybe some ice cream or maybe some cereal or something, right? But from your body's perspective, that's just insulin, 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 which is keeping that seesaw locked in a disadvantageous position for you, forcing your body to hormonally be storing, right? So we're trying to fix disease here, family, all right? So we're gonna need to make a little change. So what I'm proposing is, look, you just ate dinner. You're not starving, okay? Let's control ourselves and let's move with a purpose, all right? So what we're gonna do is after dinner, you're only having water, black coffee if you choose, that will keep me awake all night, or you can have green tea, okay? So now you're seeing no insulin through this period of time. Make sense? Now, you go to sleep. When you're asleep, you're not eating. So you see no insulin during this period of time. Now, Japanese doctor by the name of Dr. Oshumi wins the Nobel Prize in medicine in 2016. He shows that if you can go 12 hours without seeing insulin, that's where the seesaw flips. No insulin, so here comes growth hormone. Okay, and growth hormone's role is the exact opposite of insulin. Growth hormone is a catabolic hormone. So insulin is anabolic, growth. Growth hormone is catabolic, breakdown. Okay, so that starts for me at 8 o'clock in the morning, giving my body the hormonal signal to utilize. So you want to keep growth hormone out in your system for an additional 4 hours, which puts your first meal of the day not before noon, which in my case is when my office conveniently closes for lunch. So first meal comes at 12. Now, I know, and usually I have the luxury of looking at my patient's face when I explain this to them, and their reaction says everything. If you can do this, you get this piece of the pie every day. They studied this in the New England Journal of Medicine at length in 2020, and they showed that growth hormone levels increase by 2,000%. Okay, now we're getting somewhere. That's your body speaking its language, hormones, giving a direct command to utilize, break down, okay? We're humans, we need to eat, but we're gonna get it all done in this 8-hour period of time, right? Because just as we're humans and we need to eat, it should also make sense to you that we need to stop, okay? We can't be all the time snacking. For example, our ancestors didn't have cabinets and pantries, right? They would eat something and then you took a period of time and you didn't eat something. And that's essentially the problem. We're going against our biology. We should be eating and stopping. So the idea here is stop and you give yourself 16 hours with no insulin. Has anyone ever heard the term insulin resistance? Right? That's what diabetes is. It means you're seeing too much insulin. So this logically, intuitively, you don't have to be a Harvard graduate. Again, lower the insulin levels and you're going to be able to get rid of diabetes. Insulin is the hormone that's telling you to gain, store, grow. Lower your insulin levels and you're going to lose weight, right? Insulin is the hormone that's telling your body to produce cholesterol molecules. Lower your insulin levels. The cholesterol is going to come down. There's no question about it, right? And insulin is also instrumental in blood pressure. So when you lower the insulin levels, you are going to lower your blood pressure. It doesn't matter where you are in your clinical picture. This is where you are going to start and you're going to be able to actually gain some ground and start making some progress.
And we're back with Dr. Fabian Garcia of the MedHealth Clinical. So Doc, we hear a lot of information coming at us about chronic inflammation, chronic disease.
Right.
Tell us a little bit about, in your medical opinion, how we should be aware of that information.
That's great. Yes. So chronic disease, basically, to define it, these are all these progressive diseases that the medical community tells you that you can't get better from. This is high blood pressure. Hey, just, take your meds. You're going to be married to these meds. This is your diabetics, right? They're told that diabetes can't improve. It's a lifelong diagnosis, right? Heart failure, these kinds of things.
But hey, Doc, I understand chronic inflammation, but I don't know if that necessarily affects me. I don't have swelling. I'm not seeing any outward signs of that. Does that mean that I don't have chronic inflammation?
I mean, bottom line, you just have to understand the problem. Right now, you don't understand the problem. You don't know why is my blood pressure high? I can't get it down. Why do I have these eczematous lesions on my skin? Why do I have depression? Why do I have Crohn's disease? Why do I have rheumatoid arthritis, right? You don't get it. But when you see it, which is the point of this, you got to make patients understand why, how. And when you see it, then it all just becomes behavioral change, different decisions when you go to the supermarket, other kind of habits you want to engender, thinking about your sleep, these kinds of things. So, I mean, bottom line is, patients aren't stupid. If you tell them, if you do this, this, and this, it's going to help you in this, this, and this way, they're going to bend over backwards to do it if it makes sense to them. And that's the point. That's what we're doing.
Wow. Hey man, I'm excited about this next segment. Please tune in. Dr. Garcia is getting ready to drop some gems that's going to be able to help us manage a healthy lifestyle. Let's get into it.
Let's work.
I'm Dr. Fabian Garcia, the medical director for the MedHealth Clinical here in Winter Garden, Florida. On DocTalk today, we discussed weight loss and a powerful strategy to be able to help you break the endless cycle of more medications. On our next episode, we're going to discuss chronic disease, chronic inflammation, and most importantly, how to fix it. If you would like help on your journey towards health, give us a call, 321-422-2303, or you can log on to the website that's at the bottom of your screen. MedHealth Clinical, less meds, more health.